Jacksonville from Wisconsin, and someday I'm sure we hope to bring the Badgers and the Packers to Florida. Ladies and gentlemen, Dr. No.
Thank you for that great introduction. And now that my CEO is gone, I can really talk to, I can say whatever I want, right? Well, thank you, Frank, and thank everyone for having me here to share with you a little bit about brain injury rehabilitation. Due to the various factors affecting the rehab environment these days, we've had to change the rehab setting in order to best care for our patients with brain injury. As most of you know, the course of brain injury rehab can be long and arduous, often takes months, years, or if not a lifetime. As a matter of fact, an anesthesiologist friend of mine once said, rehab is like watching corn grow. And I'm from Wisconsin, so that analogy is pretty fitting. But to me, rehab is where the fun is. And no offense to Dr. Kerwin, but no one really wants to be in the trauma center. But once they're there and they're not able to go home, everyone wants to come into rehab. And what I hope to share with you today is an overview of the vast amount of services needed to care for someone with a brain injury, particularly those with a severe brain injury. And you will see the corresponding video footage just above of the setting that a patient with a brain injury typically needs. Now, brain injury rehabilitation really begins at the time of injury. Appropriate community resources are needed to allow first responders to quickly bring those patients to the nearest trauma center. And here in Jacksonville, we're fortunate to have the state-of-the-art trauma care at UF Health. And after acute care, patients with severe brain injury often need an extensive amount of rehabilitation. The entire continuum of brain injury rehab may take place in an acute inpatient rehab hospital, a skilled nursing facility, or home with outpatient therapies. The last and final phase of rehab is vocational rehab and adaptive sports to allow one to return back to the workforce and leisure activities. The initial phase of brain injury rehab typically takes place in an acute rehab hospital. In this setting, patients receive a hospital level of care along with an intense therapy program to provide a multidisciplinary, or it is provided by a multidisciplinary rehab team. And I'm going to make an attempt to list everyone, and there are a lot, as you well know. A rehab team typically includes a physician specialized in physical medicine and rehabilitation, preferably with expertise in brain injury rehab. That would be me. A neuropsychologist, a speech therapist, occupational therapist, recreational therapist, case managers, social workers, chaplain, dietitian, a behavioral aid. I think Dr. Ganti mentioned earlier a sitter. We'd like to call them behavioral aid instead of a sitter because they actually do help rehabilitate a patient. And most importantly, our four-legged German Shepherd therapists. Not only these professionals are skilled in rehabilitation, they are actually specifically trained to care for patients with brain injury. And of course, our four-legged therapists are no exception. As you can see, it takes a huge team of dedicated professionals to care for someone with a brain injury. And the ultimate goal of inpatient rehab is to go home. Just a few decades ago, these patients stayed up to 3 to 6 months in an acute rehab hospital. Today, the length of stay for inpatient rehab is typically in the order of 2 to 4 weeks range. So you may ask, well, why the huge change from 3 to 6 months to now a couple of weeks? Well, really, it's the payers. We've allowed the payers to limit these services to such a short time. So that means that some of these patients are not able to go home. So what we have now need is to utilize skilled nursing facilities much more than ever before. To continue to rehabilitate a patient with brain injury. And of course, our four-legged therapists are no exception. As you can see, it takes a huge team of dedicated professionals to care for someone with a brain injury. And the ultimate goal of inpatient rehab is to go home. So what we have now need is to utilize skilled nursing facilities much more than ever before to continue to rehabilitate a patient with brain injury. This is especially true when a patient is recovering slowly or they continue to need around-the-clock medical care and nursing care. Examples include those who have not yet emerged from consciousness or those with significant medical and functional barriers preventing them from going home. Now, the advantage to doing that is to continue to receive rehabilitation care at the skilled nursing facility. However, the downside to that is that therapy at the skilled nursing facility is often not specific to patients with brain injury. So you have a patient treated by a therapist in an environment that are similar to those with hip fractures. So the typical multidisciplinary team that I mentioned above, with all those names that I brought up, are typically not available at the skilled nursing facility. So what we have done is to create a setting, a skilled nursing facility, that is armed with the expertise needed to continue to provide the state-of-the-art medical care. Unlike many other skilled nursing facilities, we have a medical director whose expertise is in physical medicine and rehabilitation. That these patients will continue to receive individualized care that best fit their needs. And I acknowledge that we can bring back the days of longer inpatient acute rehab. What we've done is to change the rehab settings to best rehabilitate a patient with brain injury. Now, despite all the challenges that we face with shorter length of stay and limited resources, we are still very successful at transitioning these patients home. Because the length of stay in patient is much shorter, now they go home needing much more care than they were in the past. So this means that much more resources are needed to care for patient at home. These patients are often not yet able to live on their own, so they need more help. A spouse may need to get off work to care for his or her loved ones. Parents have to do so for their children and vice versa. This is where we've become creative in finding friends and relatives and church members to help pitch in to help. So therefore, the cost of care at home now can become very high, and funding available for these services becomes much more crucial. So once a patient is home, home health is often needed. This will include a home health nurse to come to the home to make sure that the patient is adherent to their medications. Similarly, a home health therapist are also needed to come to the home to ensure home safety. A rehab physician and case managers are also available to continue the care while the patients are at home. Now, obviously, there are limitations to therapies at home, so patients are transitioned to outpatient as soon as possible. And as far as I know, I don't think our four-legged therapist makes house calls yet. So, once a patient is home and is able to leave the house, the outpatient therapies often takes place in different settings, such as the day treatment program, outpatient individual therapies, or a supervised independent therapy program. Now, the day treatment program is quite unique. It's a program that fosters an environment where patients can improve their cognitive skills, their communication skills, social skills, and emotional abilities, all while the patient continues to regain their physical abilities. This type of settings allows for intense therapies up to 6 hours a day while the patient goes home at night. The length of treatment is typically 8 to 12 weeks long. Unfortunately, this type of setting is only covered by some insurers. So here, for example, Medicare and Medicaid does not cover it. So here in Florida, this affects many patients. And many of these patients, therefore, do rely on charitable donations, such as the Brooks Foundation and the Brain and Spinal Cord Injury Program of Florida to fund the needed therapies. Aside from the day treatment program, even those with insurance coverage, and most of you know, the outpatient therapy benefits are often about 20 visits a year. And compared to the days of 3 to 6 months of inpatient therapies, now you have 2 to 4 weeks of inpatient therapies and 20 outpatient visits. And that's certainly grossly inadequate to care for someone with a severe brain injury. So another game-changing initiative we've done is to create an outpatient setting where a patient can receive state-of-the-art rehabilitation at a very low cost. The Neuro Recovery Center is a subscriber-based program with a nominal fee where patients can have access to the therapist and the state-of-the-art equipment. They're open 6 days a week. The center utilizes the latest evidence-based approach to maximize one's potential, specifically taking advantage of neuroplasticity in the first few years post-injury. Whereas we can't change the length of stay inpatient or increase the outpatient benefits, what we've done is to change the rehab setting to accommodate for the lack of resources to best continue to rehabilitate a patient with a brain injury. As alluded to earlier, the end of our rehab is to return a patient back to working and enjoying leisure activities. This is where the Brooks Clubhouse and the Adaptive Sports and Recreational Program comes in. They are really vital parts of our brain injury continuum. The Clubhouse is the only one of its kind in Florida, and actually only one of about 20 in the US. It is a member-run program that helps individuals regain social, physical and cognitive and vocational abilities. Again, it is solely run on nominal member fees and largely by donation and grants. And as I heard just about an hour ago, the Taro Family Foundation was generous to be one of those sponsors for the Clubhouse, so we definitely appreciate that. Now I'm saving the fun part for last, and that's where the Adaptive Sports and Recreational Program comes in. It aims to enable those living with limited physical abilities to enhance the quality of life through participation in sports and recreational activities. Now our motto is fun, fitness, and friendship. But the best part is it's free. So you can follow us on, I guess, Facebook, Twitter, and YouTube now, right? So for those of you who are new to brain injury rehab or not familiar with brain injury rehab, I hope that by now you get a sense of the vast amount of services that are needed to rehabilitate someone with a brain injury. Now, faced with the ever-decreasing amount of resources, we have managed to change the rehab setting to best rehabilitate a patient with brain injury. Now, despite these challenges, our community is really fortunate to have the expertise of brain injury rehab professionals to stay ahead of the game. And, but of course, the work is not done, and we must continue to remain innovative. The fact that we're gathering here today with many disciplines working together is an example of actions needed to better care for our community. And to answer Frank's question earlier, I guess he gave us two options. What do you enjoy most about? I picked the what do you enjoy most about work. I don't like challenges, you know. I think the most enjoying part of my job is to work with a great team of all the folks that I mentioned earlier. I think most of them are supporting me over there, just in case I screw anything up. There's still applause for me. So, well, thank you for having me.